Ji sir, I'm here.
All right, so we can.
So he's a 34-year-old gentleman with KPS 90 who presented to us with an episode of generalized tonic-clonic seizures. His MRI brain was done on 15th of January, which showed right frontal non-enhancing lesion. His surgery was done, which was
We can discuss the surgery after Alicia, after discussing the scan. Sorry for. Yeah.
Okay, sir. Yeah. So this is his pre-op MRI.
Okay. Dr. Shumaila.
There is a focal, well-defined abnormal signal intensity area in right frontal lobe, which is hyperintense on T2 and FLAIR images. And this is not causing, this is causing minimal, is not much mass effect. This is hypointense, heterogenously hypointense on T1. And I think the bottom row is post-contrast. So there's not much post-contrast enhancement. It is not following any arterial territory. And to me, this is an
Right. Dr. Shayan would like to add something.
No, I agree with the findings.
Right. I think there was some subtle enhancement, like.
Yeah. No, Dr. Shumaila keh rahi hai na ke
Yeah,
not very.
Not like yes. Yeah. So okay, Alicia.
Okay, sir. So his surgery was done, which was right frontal craniotomy plus maximum safe resection of the frontal lesion on 17th of January, 2024. These are his post-op MRI.
Dr. Shumaila, what your thoughts about the post-op MRI?
Yes. How many days post-op it is?
It was the next day.
Immediate. It is immediate post-op.
Within the first 24
very
hours.
next, yes.
Okay.
Yes, ma'am.
Yes. So I think there's a resection cavity with, fluid-containing resection cavity. And there is minimal enhancement along the meninges, which is, expected in a post-operative period. I can't see any residual lesion on this. I
And
think
Dr. Shayan?
well resected lesion, yeah.
So you will call it a gross total?
Yes.
Okay. Dr. Shayan?
Yes, even on the FLAIR images, though we could not compare on a coronal section, we see that there is almost complete resection of the abnormal hyperintensity. So it looks like gross total resection.
Okay.
Okay, so his post-op MRI showed gross total resection. His histopathology was consistent with oligodendroglioma, IDH mutant, WHO grade 2.
Right. Dr. Mazhar, so in that case, what will be your recommendation for?
Actually, इसमें gross total resection हो गई grade 2 है. There are, one can follow it up if the patient का follow-ups हो सकता है regularly.
Okay.
Total resection हो गई, there is no residual tumor at this stage. So if the patient is compliant, one should follow it up, I think.
And फिर in case अगर आप वो कह रहे हैं कि अगर आप follow up कर सकते हैं और अगर नहीं कर सकते तो फिर उसमें क्या होगा?
तो उसमें फिर यही है कि फिर जो कैविटी है सर्जिकल कैविटी को देन वी रेडिएटेड. अगर आपका ये है कि पेशेंट वापस नहीं आएगा और फॉलो अप्स नहीं और स्कैन्स नहीं होंगे तो फिर उसमें तो द अदर ऑप्शन वुड बी जस्ट टू रेडिएट इट 54 ग्रे. दैट्स वुड बी द थिंग. अदरवाइज क्योंकि ग्रॉस टोटल हो गई, अगर थोड़ी भी रेडियोलॉजी वाले हमें बताते कि देयर इज सम सस्पिशन ऑफ अ रेसिडुअल ट्यूमर, फिर तो रेडिएशन मस्त थी. सब कुछ निकल गया है आई थिंक एट दिस स्टेज, सो वन कैन फॉलो इट अप, क्लोज फॉलो अप.
And 3 months follow up with MRI?
3 months में इनका पहला स्कैन होना चाहिए एंड देन 6 months पे होना चाहिए और फिर उसके बाद 6 monthly.
ठीक. डॉक्टर अदनान?
Sorry, unmute करने में time लगा. So I agree कि we do not have to radiate at this time. Can you just tell me the age again? How old was this
34,
patient?
I think. He was
young patient.
Okay. Yeah, so young patient, that's fine. There are no high-risk features. अब ये है कि in our part of the world, we do not have IDH inhibitors. Otherwise, now, there was this trial which everybody should know of, जिसमें low-grade tumors को IDH inhibitor पे डाला था, and they had a longer PFS. But obviously, that does not will work here. So at this time, no radiation. Follow it up, and then we'll see how it goes.
And I think we can get the 1p19q correlation status also to confirm the oligo, right?
Of course, I think that is now part of all diagnosis. Without that, you cannot say it's oligo. So, yes.
Yeah. Perfect. Dr. Athar, any comments? Any...
Agree.
Dr. Riaz, do you want to add something?
चले गए वो Dr. Riaz.
Okay. Anywhere from our participants, panelists want to add something, ask any question, please.
Last questions. Dr. Asim, can I be excused? मैंने तो अपना opinion दे दिया था कि we should follow it up.
जी.
Okay.
Thank you so much. Thank you.
All right, then, if no further comments or any suggestion, thank you so much. We had 2 cases and it was great discussion. Thank you all for joining, and
Thank
see
you
you
so
all
much.
next month.
Thank you.
Thank you. Thank you.
Inshallah.
Thank you.
Allah Hafiz, thank you.
Allah Hafiz.
Thank you. Thank you.